Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And on today's episode of Skin School, we're going to talk about a overall very interesting and important topic, and that is, can skincare treat wrinkles? Right? I mean, fair question. I think a lot of people bothered by fine lines and wrinkles, and they want to know, is skincare the way to treat it? Let's really break this out. At the end of this video, I want you to be so knowledgeable, so empowered, so prepared in terms of your expectations that it's going to be very, very enlightening and helpful for you, and hopefully reinforcing whatever we end up deciding is the approach to take for fine lines and wrinkles. Okay. You may have heard me say this before, but I'm going to say it again. You're probably going to hear it say again and again. When it comes to aging, there's two sides of the coin. Side one is the shape of your face, right? Laxity, jowling, neck laxity, eyelids, all that kind of stuff. The face deflates. That's one side. The second side is the skin, the part of the face that basically, all the laxity and all that other stuff is covered by the skin. Now, when you're young, there's two qualities that exist in both of these. Number one, you've got a youthful facial shape, firm jawline, great looking neck shape. The whole face looks like an upside down triangle or a heart, okay? When you age, that heart turns into more or less a square. The upside down triangle turns into a square or rectangle. As everything comes down, you get jowling and heaviness, and I've done videos on this to describe what's happening there. But the skin, on the other hand, when it's young, it's free of fine lines and wrinkles. It has no discoloration. It's firm, taut, supple. Okay. The skincare industry is huge, right? There's tons and tons of confusion, tons and tons of products out there, all claiming to do amazing, miraculous things, leaving you as a consumer sitting back and saying, what in the world should I do? I mean, every time I go follow some ad down this road, follow some, promise down this road, I usually get disappointed. Part of that is just because some of the stuff that you're being told simply aren't truth. And then the second thing is expectations are being placed in the wrong area. So a big part of this video is to set the expectations the right way. This is an important differentiation to make. You can sag, change in the facial shape, but you don't necessarily have fine lines and wrinkles. So you can, it's a hard thing to understand, but it's absolutely possible. And I've seen this because I've been treating patients for 20 years. And when I see patients who are coming in at their 60s and 70s and their skin looks flawless, I'm talking no lines and wrinkles, no discoloration. Their skin looks supple, looks fresh and beautiful, but yet they're coming in to have surgery with me. They're having a vertical restore, they're having fat transfer, all that. It's because the shape of their face has changed, but their skin still looks amazing. And then when you go back and you ask them, and I do this all the time, I've been doing this for 20 years, asking this question every time I see this, what do you do? What have you been doing? It always comes down to the same thing. Diligent, crazy, obsessive sun protection. Some of it's because of their geography. They live in the northern hemisphere. They just don't get a lot of sun. Sometimes it's because, strangely, their generation, which is usually sun worshipers, mom told them at some point, hey, avoid the sun, it'll keep you from aging. I don't know how they got so enlightened, but they followed their mom's direction and they've applied that to their whole life. And as a result, their skin literally hasn't aged. The second component that's always a part of that story is they've been on either retinol or retin-A, some of them are retin-A, vitamin C, some combination of really effective, active skincare along the way, in addition to sun protection. I'm telling you, there's no exception to that. Of course, there's the genetic anomaly, but that's not what we're talking about here. We're talking about people who basically have done sort of the right things for a long time, and it shows over time. So what is a fine line? What is a wrinkle versus what's sagging? When the skin gets thinner, and remember, I've talked a lot about this and I've done several videos on this. What happens to age the skin is the loss of collagen. The reason why collagen is diminishing is because the cells inside the skin, the fibroblasts, after a certain point, they just stop producing collagen at the rate that they did when you were younger. The peak actually is when you're in your mid-20s. And after that point, there's this slow, steady descent of collagen production And as a result, if you look at microscopically, your skin starts off thick and it gets thinner, thinner, thinner with age. That thinning and loss of structure and loss of turgor and loss of anatomic strength leads to skin that's more fragile, skin that's more likely to bend and break, therefore causing a fine line and wrinkle. Yes, skin can be exacerbated by the sagging components to it. But what we're really defining as a fine line or wrinkle is independent for the most part of the overall facial shape. And why that's important is because you can do all the surgery you want, but if you've got fine lines and wrinkles in your skin, those aren't going anywhere. You can't iron those things out. They are embedded in the structure of the skin. And this is something that I spend a lot of time talking to my patients about, because a lot of them come in and they've been sun worshipers, or they're coming to the game a little bit later in life. They're in their 60s and 70s, etc., and their skin has basically broken down or a lot over time, and they haven't really taken care of it. And there's tons of fine lines and wrinkles around their mouth, around their eyes, etc. And the most powerful vertical restore procedure, the most hardcore of the hardcore procedures, cannot get rid of those fine lines and wrinkles directly as a result of surgery. So the fine line and wrinkle phenomenon is a skin phenomenon. The sagging phenomenon is a deep soft tissue change that happens totally independent. What you have control over is the prevention or improvement of the fine line and wrinkle. And how do you do that? So we already said sun protection, so let's not beat that dead horse. If you're gonna take any of this seriously, you gotta start with sun protection, right? Tons of videos on the topic, speak to it all the time, but start with that. But that's by itself is not gonna be enough. If you've already matured up and you've got some skin changes and fine lines and wrinkles, now it's time to reverse them. How do you reverse them? How do you improve upon them? Well, nothing beats daily use of active skincare to improve fine lines and wrinkles. So to answer the original question is yes, indeed, fine lines and wrinkles can be significantly improved and totally prevented with skincare. So what are the components of that type of measure? So basically it comes down to things that are gonna stimulate collagen, things that are gonna plump up your skin, right? So things that are gonna stimulate collagen are gonna be, the big three are gonna be retinol, vitamin C, niacinamide, throw in some growth factor, throw in some peptides. 5 big hardcore actives that are stimulating collagen and turning those fibroblasts on and improving things over time. How do you plump up the skin right away? Hyaluronic acid. Hyaluronic acid gets into the skin, it functions like a sponge, it brings in moisture into the skin, and it causes the skin to plump, almost immediately seeing changes and improvements in the fine lines and wrinkles as a result of that. And when I say immediately, I mean within a week or two as it continues to draw more fluid into it, improving skin turgor, improving suppleness of the skin. So when you put all that together, improving collagen and drawing water into the tissues, you're basically gonna see fine lines and wrinkles improve. Tons and tons and tons of studies, including the study that was done for the Trifecta, which is our product for Karam MD, which is the 3-step all-in-one anti-aging product that basically has all the things that I just mentioned. In those 3 steps, we did a third-party study, and one of the parameters was fine lines and wrinkles, and it blew the study out of the water in the sense that the before 1 month and 2 month changes in fine lines and wrinkles were beyond statistically significant. I mean, there were huge improvements. And people who use it see that on a regular basis as well, obviously, and it gets better as time goes on. So in addition to our study, there's tons of research that's been done on retinol in general, niacinamide in general, vitamin C in general. All of it points to improvement of fine lines and wrinkles. So those pesky little lines around the eyes, the lines around the mouth, all that stuff can be basically improved significantly if they've already happened to a certain point. And I'm going to caveat that for a second, but if you're young enough to be watching this, get on it right away. Get on this aspect right away, because you can literally prevent your skin from ever aging if you just do these 2 things: sun protection and the right actives, right? And the whole idea of the trifecta was to make deciding between all those different things out there really easy to make. Let me make the decisions for you and test it and make sure it works, and then you use it. Now the caveat is, if you're to a certain age and those lines have really dug into the skin, you can't, I mean, you'll improve them, but you can't get rid of them, probably without doing like a deep laser resurfacing. So for a lot of our surgical patients, some of them are still too deep for this, but we'll do a deep erbium YAG laser resurfacing where we're just kind of like going layer after layer to try to get down to the base of the wrinkle, especially around the mouth, those vertical lines, you know, around the chin and area, and just try to like, you know, smooth them out as much as possible. You can only go so far because if you go too far, you'll get to a point in the dermis, which is the, you know, the actual skin, that it won't heal itself. You'll just end up with a scar. So you can't go too deep, but you can go deep enough to usually make a significant improvement. And then, you know, you might have to repeat this. Additionally, some other non-surgical treatments, non-deep laser resurfacing treatments that can help is the repetitive, consistent use of like microneedling over time, with or without very, very mild, shallow radiofrequency. And I say shallow, I mean less than 1 millimeter, generally speaking like half a millimeter. And the reason for not going deep is you're gonna melt the fat that's below the skin, and you need that to keep your skin looking supple and youthful. Okay, so again, talked a lot about radiofrequency type stuff, and that is an important point to keep in mind. So you don't wanna go too deep with it, but you do wanna kind of, you know, keep that skin tightening, stimulating collagen with each treatment. Whether you use radiofrequency or you just use straight microneedling, you'll see significant improvements over time. So the order is sun protection, actives that I just mentioned, microneedling, deep laser resurfacing, and patience and consistency with time. You do all of that, you'll improve the overall outcome. But the short answer to the age-old question of does skincare help with fine lines and wrinkles, it's a strong yes. However, not all skincare and not all you know, ingredients. It doesn't really even matter how much you pay, because there's a lot of stuff that's bottled in really, really expensive glass jars that are no more than just a moisturizer. So be very, very careful. You're smarter than that now. You know you got to look for actives that are doing the things that I just mentioned. Put that all together and you'll see some nice improvements over time. All right, folks, I hope that helped give you some insight and perspective over this very interesting and important and I would say, you know, relevant topic, which is skin aging. 50% of your facial aging and the 50% of the reason why you're gonna look as young as you feel is gonna come from your skin. So either if you've had surgery or you can't have surgery or planning on having surgery or whatever the situation, focus on your skin. The dividends will be very high. You'll enjoy the changes. Everyone loves looking at themselves when they have like bright, beautiful, glowy skin, whether or not you have gels or not. It still, you know, adds a lot to the overall picture. All right. I hope you enjoyed that. If you have any questions at all, drop them in the comments below. I'd love to hear from you no matter what. If you liked it, hit like. If you haven't already, subscribe to my channel. I give you topics like this and all things facial rejuvenation. The Karam MD Journal, which is our newsletter that comes to your that comes to your inbox, is really worth signing up for. It's something I write every week, and different topics than what I speak about on these videos, and you'll find it very enjoyable and very shareable type topics as well. And share this with any friends and family that might find this interesting. I think the more we know, the more we're empowered, the better we're able to make good decisions, the better off we all are, and the more confident we're going to feel with our decisions. So please share this along. So I hope you all enjoyed this. Till next time, Dr. Amir Karam.